One woman dies of cervical cancer every 8 years.
Deodorants may contain some harmful chemicals. Cervical cancer is the second most common cancer in females in India.
Smoking accounts for 1 in 10 deaths.
Women are being diagnosed 10 years earlier than the Western population. 60% of the patients are coming at loco-regional stage, that is a quite advanced stage. Before they are sexually active, they have to get vaccinated.
Breast cancer accounts for nearly 14% of all cancer.
That all the treatments are available in our country.
Good afternoon, friends. Welcome to another episode of Medicine Unmasked. In continuing with the last episode, we are in month of February. It's an important month. We said last time that we celebrate World Cancer Day on 4th of February. I emphasized on the importance of it since 1999, since the Paris Declaration. There is a common theme around the world of how we can educate, empower, and improve cancer survival. Why we talk about this? While we are recording this, one woman dies of cervical cancer every 8 minutes in India. If we are going to talk about 15 minutes, I think we will lose 2 people. For every 2 women newly diagnosed with breast cancer, 1 woman dies in India. And to the contrary, that a popular belief, smoking accounts for 1 in 10 deaths among women in India. This is some important facts. But as I always say, hope is always there. We have people. I want to introduce Dr. Aditi Mittal. She is a senior consultant, somebody who is part of this hope campaign. And I want to ask her some questions about how we are helping people to fight this battle, or maybe even an epidemic of growing cancer. We're going to focus on women cancer. So welcome, Dr. Aditi.
Thank you.
Just quickly, I want to ask you some very generic questions. So some believe that wearing tight innerwear or using deodorants can cause cancer. Is there any scientific evidence to this?
So, no. First, in one word is no. So few study came in 90s which showed that wearing a tight innerwear may lead to it because of obstruction of the lymph flow. But later it was refuted by many studies, and it showed that there is no relation with the association of the cancer and the innerwear type, material, how tight it is. It doesn't matter. Regarding deodorants, yes, deodorants may contain some harmful chemicals like parabens and aluminium. So people say that could have caused, these chemicals could have caused, because breast is near the axilla. But still there are very few studies telling this fact, and still we need more studies to actually comment on this point.
Okay. So many people believe that the breast cancer always presents as a lump. But क्या कॉमन साइंस एंड सिम्टम्स हैं, अर्ली वार्निंग साइंस जिसको बोलें, जो ब्रेस्ट कैंसर के लिए पीपल शुड बी लुकिंग आउट फॉर?
So I'll tell it in a very easy way. So you have to basically remember 5S. Size, whether there is a change in the size of your breast, one breast is bigger than the another,
Okay.
or the nipple maybe. Then the shape.
Okay.
You are not seeing the shape is not normal as you have always seen your breast, and if there is any change in shape. Symmetry, again similar thing. There is no symmetrical thing. The breasts are not similar. Then we have a swelling. The swelling in the breast or swelling in the axilla.
Okay.
Both, if you notice anything, then you should consult your doctor. Then the skin changes. So skin may be red, may be swollen. There may be discharges from your nipple. It can be ulcerated wound on your breast. If there is any changes among these 5S, then you should consult your doctor.
So some believe if you have no one in their family had cancer, they are safe. So how much of breast cancer is hereditary and how much is influenced by lifestyle factors?
So, unfortunately, only 10% of the breast cancer people have a hereditary cancer gene. Only 10%. So, we can think that 90% of them do not have any gene, actually making them more susceptible to it. So, it's a high ratio. And yes, change in our diet, in our lifestyle, is the major reason for increase in the number of cases for breast cancer, because smoking is not related to it much.
So, moving along, and I'm just going to focus on two cancers today, which are very, very common in India. One is breast cancer, and second is cervical cancer. So, Dr. Aditi, as per my understanding, breast cancer accounts for nearly 14% of all cancers in Indian women. Why is it increasing? Why are we seeing younger people getting affected with this?
So, yes, the numbers are actually very alarming. In a year, more than 2 lakhs new breast cancer patients are being diagnosed. And our data is very poor than, I would say, compared to the Western population. So, we need to do something about it. And why we are having in a younger population? It seems more of a genetic relation. Yes, our women are being diagnosed 10 years earlier than the Western population, and the cancers are more aggressive. They are diagnosed at very advanced stage. So few things that we can do is that, of course, the screening part, we can diagnose them earlier. In if data wise, I would say in USA, 60% of the patients are being diagnosed at local stage, that is 1 and 2. In India, it is the reverse. 60% of the patients are coming at local regional stage, that is a quite advanced stage, that is stage 3. So that is one factor of more mortality in our patients, less survival for our patients.
सो जैसा आपने बोला कि हम हमारे पॉपुलेशन यंगर पॉपुलेशन मोर एडवांस्ड सो अगेन आई थिंक दैट्स अ वरिंग factor, but as a doctor I'm sure you will see the brighter side of things also. I'm sure survival is improving in India. So my next question is, yes, we are getting diagnosed in a later stage, the breast cancer are more aggressive, so how can you but give them a hope that if diagnosed early, what are the chances of survival with breast cancer? What can people do? How frequently should they get screened? If they are getting suspicion, who should they contact first?
So, breast cancer. So, if diagnosed early, I will actually see the brighter side. In USA, the chances of getting cured and 5-year survival rate is 99%. That is very high and very good. So, I would urge all the females and the males of the family to come to the doctor at the very earliest if they see any sign and symptom which is worrying, or the 5S that we discussed. So, talking about it, I think the dialogue in the community is very important. When females in family, you talk about it, so people will come. The female will come, their mother, their sister, their wife would come. Okay, I have noticed it. So, the dialogue in the community among the female members, the stigma to be removed, and openly discuss about these things, then only more and more females would come early, and they would come for screening also. Getting checked, it will not be stigma anymore, and thus we'll have a better survival rates.
So, just my last question regarding breast cancer. Let's say somebody gets diagnosed with breast cancer in India. How far is the treatment, let's say, in a Western population and India? Because I hear that we are advancing, we're getting new treatments, people are surviving better. Overall, as you said, 95% survival rate. So, talking about today's landscape in India, what is the possibility that if somebody unfortunately gets diagnosed, what are the chances, what are the treatment options, and how close are to we becoming closer to the Western data?
So, it's very good that all the treatments are available in our country, whether chemotherapy, radiation, surgery, all the advanced techniques and advanced drugs are available in our country. That's the first point. Secondly, more and more government schemes are coming to help the population to complete their treatment. So it's really helpful for the females. In fact, for low income patients also, they are able to afford the treatment and complete the treatment. So this is very nice. And I think the main is awareness and action that we have to take care of. And I think if we all are very aware, so people, I think when we started with vaccination many years back, people were not ready to get it. But now everybody, the vaccination rates have risen. Similarly for this thing also, people are not talking about it, but they will, and we will have better survival rates.
So I think the second most, or would say, as per some data from I've got from ICMR, is that cervical cancer is also responsible for 18% of cancer-related deaths among Indian women. So, first of all, why cervical cancer is rising? Second, again, what can people again do to be self-aware? एंड कई बार लोगों को लगता है हम किस डॉक्टर के पास में जाएं, क्योंकि डायरेक्टली हम कैंसर के डॉक्टर के पास में जाएं, पीपल हैव स्टिल हैव दैट स्टिग्मा कि हमारे को कैंसर नहीं है. पीपल आर ऑल्सो इन डिनायल. सो टू क्वेश्चंस. वन इज व्हाई इज दिस राइजिंग, एंड सेकंड इज इफ देयर इज समथिंग दैट दे आर कंसर्न्ड ऑफ, who should they go to?
Cervical cancer is the second most common cancer in females in India. It accounts for almost 80,000 new cases every year. That's a large number. But it's like frequency has decreased because of better, I would say, better cleanliness. The cervical cancer has been controlled, I would say. And for cervical cancer, we have like a silver lining, that is the vaccination. So if we start today and vaccinating our teenage girls, then 90%, more than 90% protection is from HPV infection, which is the main cause of cervical cancer. So we can decrease the cervical cancer cases rapidly. Coming to the second question, then whom should they go? That is, of course, the gynecologist. They should first go to their gynecologist. They will do the pap smear, and they will examine them, and if there is anything which is positive and or the pap smear shows anything, then they can go ahead with their oncologist. Otherwise, gynecologist is sufficient. And the basic like cervical intraepithelial neoplasia, which is the harbinger of cancer, can be treated by the gynecologist also. So pap smear is the first thing that they should get by their gynecologist.
So one thing which is very important is we have a vaccine against cervical cancer. So I want to ask Dr. Aditi two questions regarding cervical cancer vaccine, because it's a very important point that 90% of cervical cancers can be prevented by just vaccination. So one is, who can get it, how easily it is available, and are there any major side effects of the cervical cancer vaccine?
So best age to get cervical cancer vaccine is the teenage girls that I said, that is 9 to 12 years. But the people till 26 can also get it. Of course, the efficacy decreases, but still it is good. And now it has been expanded to till women age 45 also. But best time, again, I would say, reiterate this point, teenage girls, before they are sexually active, they have to get vaccinated. Okay. So for second point, yes, it is freely available in India. There are two brands which are coming, Cervarix and Gardasil. Both are good. There are 3 shots that you have to give to the patient or the subject. And about the side effects, yes, of course, there are few side effects like injection site reactions. That at where we have given the injection, there may be some swelling, some redness, some pain. That we generally observe with other vaccines also. Hepatitis B also we can have injection site reaction. No major reactions related to this vaccine, which is very different from the other vaccine. It's mainly the injection site reaction that we have to take care of.
So again, vaccines are freely available, very minimal side effects, teenage girls, 3 doses. I would re-emphasize this. Let's say that somebody who is in a population of, let's say, high risk age, which from my understanding, let's say they are 30 to 40. My 2 questions: how frequently should they get or is there any recommendation get mammography or examination? Second is, how frequently should they get, like you said, pap smear, जो कि एक cervical examination होता है जो locally gynecologist कर सकते हैं. It is not very invasive. So two things, if you can make people aware, how frequently mammography and how frequently pap smear.
So I'm talking about normal population who does not have any history of breast cancer, breast and ovarian cancer in their family, like the normal population. For them, after 40 years of age, they should get yearly mammogram.
Okay.
And at the 75, of course, we stop. And if any suspicion lesion is found in the mammogram, the action are taken accordingly. For the patients who had history of breast cancer in their family member, or they have the gene for the breast cancer, they should start early, maybe at the age of 25, 26. And we generally do ultrasound and MRIs for them because that is safer for them. So we start with that. For cervical cancer, pap smear is the one. And we start with of course, again, we have to find the high risk population. So for them, we start with around 35 to 40 again. And if for yearly, if we get the pap smear which is negative, we can make it twice, like every 2 years we can do it, or we can make it every 3 years also. And after they attain menopause, then generally we stop.
So I think thank you for covering a lot of aspects today about women cancer. One thing, as I want to ask you, and this is also something that, somebody who's got diagnosed with cancer in our society, what is the help that is available from terms of maybe psychological help, from terms of how families can kind of, make an ecosystem around them, how you as a doctor help them. So just what do you go through? What do you suggest once they are diagnosed with cancer, apart from the treatment part of it?
So I think whenever a patient is diagnosed with cancer, it's their worst dream that has come true. It's the worst shock of their life, the most difficult time. So each member of their family is a very important pillar. Maybe their fathers, their sisters, their mothers, their children. Everybody is support for them. Emotionally, financially, socially, not to feel bad about themselves. Everything is by family only. Because as a doctor, as a medical healthcare team, we are with them barely 1/4 time of the day. The 3/4 they have to be their own. The family support is the most important thing. And they get it. We have seen patients fighting very sinister diseases with the family support, and they have come out of it. We have great examples with them.
So, one last question. If you were going to give one message about getting frequent examinations, there is some hesitancy still, even in the educated population. How can we just taking away the fears of regular examinations? And what is the message that you want to give to the viewers today?
So, we always fear what we don't know. So, more information creates more trust in the treatment, and I think awareness and dialogue with each other, talking about what we fear about cancer, what we don't know about cancer, asking your peers, more educating them, and removing the fears around that diagnosis, around the treatment. I think patients are more fearful of the treatment rather than a diagnosis.
Yes.
कि कीमो से ये हो जाएगा, कीमो से मैं काला हो जाऊंगा, या मेरे बाल चले जाएंगे. So they are very worried about the side effects also. So we have to allay that anxiety. We have to create and build a trust among them. We have to give them more examples of the survivors, and thus they get the ability to start treatment and actually fight this disease.
So, thank you, Dr. Aditi. It was really heartening to know that very simple steps regarding breast cancer, the 5S Dr. Aditi talked about. For cervical cancer, hope is there. I think if we can start this fight earlier in teenage children, or and vaccine availability is there. Third, I think survival is increasing. Fourth, there are very simple steps, or self-examination, investigations that can be done in population. And fifth is, I think, people are uh, fighting this disease together as a society. One last message about the World Cancer Day you want to give to the population. What is the theme this year? What are you doing on a personal level?
So this year the theme was United by Unique. It says that every person is unique, their cancer is unique, and their life story is unique. But still, we are united by one diagnosis and we are fighting against it. So, it's a beautiful theme. And uh, on a personal level, definitely, my agenda is at least I should ask at least 5 to 10 people every month to quit smoking. That is my agenda.
Thank you. Thank you for watching, and thank you for listening to us.